All right, so prior to working with any patient that is experiencing BPPV symptoms, I want to clear the cervical spine first and make sure there's no pain or any underlying symptoms occurring there before I have the patient lying down and moving their neck in a different way. So first I'm going to have the patient look straight up towards the ceiling. Any pain with that? I look down towards the floor and rotate to your left and to your right, and left ear to your left shoulder and the right to the right shoulder. Any pain with any of that? Okay. So also prior to moving these patients, we want to clear the vertebral-basilar arteries. So there's two vertebral-basilar arteries supplying blood to your brain, and if those are cut off, then there's not adequate perfusion to your brain. So, and if that's the case, we have an immediate referral to the physician or the emergency room so that the patient can receive appropriate care. So in order to do that, I'm going to have the patient sit on a stool.
Hi there, I'm Sienna. I'm going to be your physical therapist today.
Jenna.
Nice to meet you, Jenna. So what brings you here to physical therapy today?
I've been getting really dizzy.
You have? When did this start?
Well, I have I guess a month ago.
Oh yeah?
But I have, it comes and goes every now and again.
So it's not constant for you?
No.
No.
Episodes, maybe 15 seconds, but they happen probably 3 times a day.
When do you notice this happening?
Every time I get off the couch. I like to watch a lot of TV. So when I'm laying down, and
So
then
you're lying on the couch usually, not sitting there.
No, when I'm lying down.
Okay. So do you notice this when you're is it when you're getting up to stand, or is it more so when you're rolling over?
No, so I'm lying down for a little bit, and then I go to stand up.
Yeah.
And then when I look down and then look back up, that's when it's the worst.
Do you ever pass out or throw up or anything from that?
I get a little nauseous, but I just thought that was normal.
Okay. That it's been happening more frequently.
Yeah, and dishes. When I do the dishes,
yeah,
I can't wash my dishes anymore because when I go down and put them in the dishwasher, I feel like I'm going to faint.
Do you notice it on one side more than the other or anything?
Not really, no. The room is literally spinning, though.
It is, yeah. And it just
Not me personally, but the room.
And it just lasts for a few seconds, then it goes away when you sit down, or do you do anything for that?
Yeah, I usually just sit down. I notice if I put a cold ice pack, that helps sometimes, but that's about it.
Do you ever feel any fullness in your ears, like your ears are blocked or anything, or ringing in the ears? Either one of those?
Let me clean them out. No.
No, okay. And no ringing? Nothing.
Only when my husband rings his bell.
Okay. All right. What about, do you have any hearing loss in either ear?
I'm 82, of course.
Okay.
More so my left.
But this is nothing that's new to you?
No.
Okay. Never had vertigo before?
Vertigo?
You've never heard of
No,
vertigo? Okay.
no.
So you've never had any issues with any of this dizziness before?
Only until about a month ago.
Okay. Sounds good. So what I think is going on is that you might be experiencing some vertigo, and based on what you told me, there's 3 canals in each of your ears, an anterior, a posterior, and a horizontal canal. And based on what you're telling me, I think the anterior canal is involved. So what I think is happening is there's these crystals in your ear, and I actually think they're not supposed to be in the canals, and I think they're dislodged into your anterior canal based on you telling me that it's when you go bend over is when you're experiencing these symptoms.
I have crystals in these things.
Basically, it's calcium.
Boy.
It's not real crystals, it's calcium. Okay.
I like my sodium too, though.
Okay. So I think they're dislodged and in here, which is what is causing you when you bend forward. Those crystals are going into that, what I said, anterior canal, and that's causing those you to experience that dizziness and sick feeling that you're feeling.
I don't like it.
So what I would like to do next is test that out just to make sure what I am thinking is actually correct, and then go from there and treat you if you do have vertigo in one of the canals.
Let's get them out.
Sound good?
Sounds good.
All right, Jenna. So what I want to do next, the examination that I want to do, it's called a bilateral Dix Hall peg. So what I'm going to have you do is I'm going to talk you through the whole thing. There's nothing you have to do. You're actually going to turn around and sit on the table, and I'm going to slightly tilt your head backwards, and I'm going to hold it so there's nothing to be scared of, and I'm going to bring you back over the table. And while you do that, I'm actually going to look at the direction of your eye movement, and that's going to tell me what it's called that I'm seeing is called nystagmus.
But you said they're in my ears.
It is, but it affects the way your eyes affects the eye
Oh.
movement. Everything's connected up
Oh,
there.
that's different.
Yeah. So your eyes are actually, the movement of your eyes will actually tell me specifically what canal is involved, which is what I talked about those 3 canals earlier. So if it is correct and they are in the anterior canal, your eyes will actually go downward and torsion, which will clarify that it is the anterior canal that is involved.
Okay.
Okay?
Sounds good.
All right, and if you feel sick during this, or just let me know, and that should pass. It should only last a few seconds. If it doesn't, I have a bucket right here if you...
Up chuck.
Yeah. Alrighty, so if you can turn around for me. Alrighty, good. So just relax, and I'm
You
going to
need
do
me to
everything.
put up my Goldilocks.
You're okay. Alright, are you okay? Alright,
Let's
just
do it.
trust me here. Alright, so keep your eyes open at all times. Okay, tilt your head back, and bring you backwards. Alrighty. So your eyes actually are downbeating and torsioning here, which is confirming that it is in the anterior canal. So I'm going to hold you here in this position until the nystagmus goes away. I'm going to bring you back up. Based on what I just did in this examination, I did confirm that it is the anterior canal based on the nystagmus, like I said, going downward and torsioning. However, I couldn't tell which side of the nystagmus was more intense. But that's okay.
That's
I can
normal.
still fix I can still get the crystals out. So what I'm going to do to fix that is literally the same thing we just did. I'm going to do it 3 times and hold you in the position for 2 minutes. And once I'm done that, you actually shouldn't be experiencing any symptoms, and those crystals should be out of there and back into their normal position to have that balance between your right and your left ear.
Now, can those crystals come back out?
It usually shouldn't. Everything should be back in place, and you honestly should be back to normal after that.
Oh, let's do it.
Are you okay with this?
Let's get it rock and
All right,
rolling.
so same technique 3 more times. Alrighty, so put your head up. Matt, again, keep your eyes open. I'm just watching the nystagmus. I'm going to hold the patient here for 2 minutes. The nystagmus is now gone, and 2 minutes has gone by. Bring the patient back up. And I'm going to do this technique for 2 more times. So how do you feel?
I'm okay. A little dizzy, but I'm okay. Not as nauseous as I usually get.
Okay, sounds good. So based upon the bilateral Dix-Hallpike exam that I just did, I was able to confirm that it wasn't your anterior canal that is involved. And I was also able to see, based upon which eye movement was more intense, that it is your left anterior canal that is involved. So now I'm going to do a technique called the reverse Epley maneuver. And that's actually going to get those crystals out of the left anterior canal, and hopefully get everything back into balance and where they are.
Sounds
Are
good.
you okay with us doing that?
Yep.
Now you may feel a little nauseous, but that should go by pretty fast.
Sounds good.
Be able to lie on your stomach for me. All right, so I'm going to lie on your stomach. Hit your curve.
Oh.
Okay?
Yeah, sorry.
All right, so first what I'm going to do is I'm gonna keep your eyes open the whole entire time. So first I'm gonna have you turn your head to the right side. So move your hair out of the way. Alright. So open your eyes. I'm gonna have you look at me. Just keep your eyes open. Good. So I'm watching for the nystagmus, and I'm holding her here for a minimum of 30 seconds or until the nystagmus is gone. So the nystagmus has gone away. I'm gonna turn her head to the involved ear, 45 degrees. Same thing. Until the nystagmus is gone, a minimum of 30 seconds. Good, it's gone. So now I'm going to turn you onto your back. Keep your head in this position for me, please. Good, good, good. Okay, and the nystagmus has gone away again. Okay, now I'm going to have you, can you roll onto your left side for me, please? Careful. Good, keep your head in this position. Stay looking up. Good, good, good. Nystagmus has gone away. Head back to neutral. Relax. Feeling okay?
I feel good.
All right, great. Alrighty, so that was basically all we had to do. That was all we had to do for that treatment. Alright, so basically after this, your symptoms should all be gone. I'd like to see you again in 2 days just to make sure everything's okay, and we can also check out your balance from there and see if we need to work on anything else for physical therapy.
I use my walker.
Oh, good. Okay. Do you have any questions for me?
Nope. I will see you on Tuesday.
All right, sounds good. Thank you.
Hi, Sienna. I'm Jen. I'll be your physical therapist today. How are you doing?
Hey, what's up? I'm okay.
So, what brings you in?
Well, my mom made me come.
Are you having knee pain, hip pain?
I've been getting dizzy,
Okay, so can you tell me what your dizziness feels like?
nauseous, like I'm on a merry-go-round.
So, are you spinning? Are you just like your vision's blurry?
I got the spins.
You got the spins?
Like almost as if it was like a night out.
Oh, okay. I understand. All right, so do you have any ringing in your ears that you've noticed lately?
I don't think so. I play my music loud, but
But no ringing? Okay. How about any like fullness in your ear? Like you're kind of underneath the,
like if they're gonna pop,
if you're underneath in the pool, in the water? Nothing? Okay. Have any headaches?
I don't think so.
And no neck pain?
No.
No? Okay, so how long ago did this dizziness start?
Like 2 weeks.
2 weeks ago? And how long does it last?
Just a couple seconds, which is why I think I'm fine.
Okay, and how many times a day does this occur?
Basically, just in the morning when I roll out of bed.
Okay, and do you know which side you kind of roll out of bed that this occurs on, or is it just whenever you roll?
Well, I usually roll out of bed on my right side.
And that's when it happens?
Yeah, so I had to switch to the left.
Okay. And how's that?
Inconvenient.
So, what I think is going on is it's called BPPV. So, we have 3
What does
canals,
that stand for?
benign paroxysmal positional vertigo. Okay? So, basically, vertigo is spinning. You see the room spinning. So, what I think is going on, you have 3 canals in both of your ears. You have a posterior, anterior, and horizontal. You also have these crystals, which is calcium carbonate. So those crystals basically get dislodged into this fluid that are in the canals, and you shouldn't get this dizziness, but when those crystals are in the canals, when you get up or when you roll, those crystals are moving, causing you that dizziness. You understand?
Sure.
Okay, so what I want to see, from what you're telling me, I think it's in your posterior canal, and it's on your right side. Because you tell me when you roll to the right, that's when your symptoms, everything starts to spin.
Okay.
Okay, so what I want to do, it's called the Dix Hall Pike. So what I'm going to do is tilt your head slightly to the left first, because I want to kind of teach you what I'm doing, and then keep your symptoms calm. And then I'm going to lay you back on your back, and I'm going to look at your eyes. So I want you to keep your eyes open as wide as you can, and by the direction of your eyes can tell me and clarify what canal it's in, as well as what year is the involvement.
That may make me sick.
I know, there's a trash can right here. I need you to tell me when your symptoms come on and when they come off, and if they're actually calming down.
Okay.
Okay? Have you ever been nauseous before with this?
Usually when it happens,
Okay.
but then it goes away. Like
And do
I
you
said.
sit down and it goes away in a few seconds? Okay. So what I want you to do is go ahead and long sit here. That way for a little bit. Okay, so what I'm going to do is tilt your head to the left, which is the non-involved side 45 degrees, as well as slight extension. I'm going to bring you back. All right, I'm going to look for any eye movement. Since this is her non-involved side, I confirmed that by no nystagmus. So I would hold her here until nystagmus stops, but in this case there is none, so I'll bring it back up. Okay? And then I'm going to start the involved side, so I'll tilt her head back slightly as well as 45 degrees to the right. I'm going to bring her back. Keep your eyes open. How are your symptoms?
I don't feel good.
In this position, I'm going to look at the nystagmus occurring, and in this case, it is upbeating as well as torsioning to the right to confirm that it is in the posterior right canal. And I will hold this until her nystagmus stops. Okay, her nystagmus has stopped and it's been 45 seconds, so I'm going to bring her back up. Okay, how are you feeling?
Ooh, that was rough.
Okay, yeah, so now I want to do the treatment of it. So what I'm going to do is actually have you slide a little bit that way. Nope, stay long sitting. Okay, so I'm going to do the same thing. I'm going to bring you back to your right side. I'm going to hold it there till your nystagmus stops, and then I'm going to have you actually roll. So I'll be talking to you through this the whole time, so just listen to my commands and tell me when your symptoms stop. Okay?
Is this going to make me better now?
It should, yeah. The crystals, I want to get the crystals from the right side, and I want to dump them to the left side. Okay. Okay, so I'm going to actually have you sit over more that way.
Am I going to get sick again?
If you get nauseous, there is a trash can.
It's killing me.
Get up that way a little bit. Good. All right, so once again, this is called the Epley maneuver. So I'm going to tilt her head 45 degrees to the right again, which is her involved side. I'm going to take her back. Oh yeah. I'm going to watch her symptoms again and wait till they calm down. So it's been 45 seconds, her nystagmus has stopped. I'm going to add 10 seconds. And then I'm going to tilt her head to the left. And go ahead and lie on your left side. Keep your head looking down. Once again, I'm going to watch her nystagmus stop. And I'm going to add 10 seconds as well, so 55 seconds has completed. Go ahead and sit on the edge of the bed, keeping your head towards the ground. Again, in this position, I'm going to hold her here until the nystagmus stops, plus 10 seconds. So 55 seconds is up, and then that's the final dump. And have her look up at me. How are you feeling?
It was rough at first, but got better.
Okay. So I want you to sit here for 10 minutes until your symptoms kind of calm down and make sure there's no symptoms going to come back on. And then I want to have you scheduled 2 days from now, and then kind of talk about if anything, other episodes occurred, or if you were getting sick again, and then we'll kind of go on from there. Okay. All right?
Sounds good.
Good
Thank
working
you.
with me today.